Good afternoon. I am Fran Rickenbach. I am the Executive Director of the National Association of Nephrology Technicians Technologists. It is my pleasure to welcome everybody to the first of a series of 6 webinars that NANT is providing in conjunction with the American Society for Diagnostic and Interventional Nephrology. Just to be sure that we understand what our ground rules are, we're going to ask that you mute yourself so that there aren't any interruptions from noise around you. You're welcome to have your camera on. We have enabled the chat, and as Dr. Khan goes through his presentation, if you have a question, you're welcome to put it in the chat, and I'll be moderating the chat and ask the question at an appropriate time. We should have time at the end of the webinar for open questions for Dr. Khan. As long as you, and I've just sent one more time the link to the form for the contact hour. Please don't be alarmed. As I see people joining through the webinar, I will be sending that again. So let me take this opportunity to introduce to you Dr. Akbar Khan, who is a nephrology fellow at the Indiana University School of Medicine Nephrology. I'm in Ohio, he's in Indiana. I think we're right on the same snow line, aren't we, Dr. Khan?
Yeah, there is some issues with them not plowing the streets. So there's a little bit of tension here in Indianapolis right now.
I understand that. So I am going to move our slide along, and I'm turning this over to you.
Great. Well, thank you so much for the opportunity, Ms. Fran. I want to first give a shout out to all my nursing staff, dialysis techs, everybody involved in the care of dialysis patients. Me as a trainee finishing up my last 6 months, I've been fortunate to work with amazing nursing staff who have taught me a lot and continue to teach me, and I'm learning from them. And Indiana University is lucky to have, a very large home dialysis program. So I want to just make sure that, I recognize and shout them out because they have definitely leveled up my knowledge and the way I look at all of this. So thank you to all of you joining in. And yes, and thank you to NANT. Do I say NANT for short? Is that how we say it?
You can say NANT for short.
Yeah, NANT and ASDIN and Miss Debbie Mauser, who's been helping me, who I met at ASN, who linked me up for this opportunity. So thank you to everyone for joining and welcome. Today in our webinar, we are going to be discussing infection prevention in the dialysis setting. And as you see on this slide, our learning objectives will be the infection prevention measures in dialysis. We talk about PPE, the critical role of hand hygiene. We highlight some additional safety precautions in high-risk scenarios, cleaning your dialysis stations. A lot of this sounds basic, but it's proven through studies that it works. So explaining it detail, word by word is helpful, and you'll see later in this presentation. So if we can move to the next slide, please.
Absolutely.
Yeah, so there is something on the left side. It didn't show up. Interesting. Okay. Well, so some infection measures, some key is it not showing up for you guys on the left side? There's like it's just showing blank. Is that me? Yeah, I think it's blank. Okay, I
Oh, wait a
apologize.
second. You have it. Hang on. There you go.
Oh yeah, okay. So some infection risks for dialysis patients. Um, We know that hemodialysis is a patient's lifeline, and our goal is to make sure that we identify these gaps in infection controls, decrease possible infections, you know, people who are getting dialysis are at a very heightened risk for infections, and that includes frequent catheter use. 3 times weekly, people are going to receive dialysis, or if they're at home, there's so many ways to get an infection, which you are all aware of. And it's our job to make sure that patients are safe and that we do things that are proven with the studies that the CDC has completed. And these, will help us decrease those infections. Next slide, please.
Absolutely.
So as of September 30th, this past year, 2024, we have over 518 dialysis patients in the country, or almost 519,000. And the majority of these patients are in-center hemodialysis, which you will go 3 times weekly, either Monday, Wednesday, Friday, Tuesday, Thursday, Saturday. And we have almost 80,000 home dialysis patients. As you're aware, we're trying to shift to more home dialysis patients if it's possible, although sounds great. It's very difficult. Indiana University has one of the largest home dialysis programs. Dr. Nupur Gupta is leading that, also with Dr. Brent Miller. We have a very large program, but still, it is not easy. And but as you can see, we have around 80,000 patients, which is still impressive. What I also want to highlight is there's almost 5,000 patients in nursing homes that are going through dialysis, which is very big. So I think it is, important to recognize that there are that many patients on dialysis, including kidney transplant patients, which make up almost 309,000. So lots of people on dialysis. Next slide, please. So we need to know, what is the burden of bloodstream infections in hemodialysis patients? And we have done a lot of studies on this. The CDC has been trying for a long time to help decrease this amount, and there has been some progress made. And as you see here, 46% reduction in CLABSIs, which stands for central line associated bloodstream infections, between the years 2008 and 2013. So we have proven techniques, which we'll explain later. We know that work, but it's not enough, because currently the current burden is approximately 30,000. Some numbers there are some differing statistics, but it's mostly around 30,000 up to 37,000 of these infections that occur annually. And what happens is that it has a major impact on our healthcare system, prolongs hospital stays, the healthcare costs, which are enormous, mortality risk. So we have lots and lots of things that are affected by this. I did forget to mention in the other slide that there is around 75,000 people that get hemodialysis through a central line, which we'll learn later, which is the highest risk for infection. So we have lots of people on dialysis and lots of ways that you can get an infection. So you can see how easy it is to give a webinar today for 1 hour talking about how we can decrease those numbers. So next slide again. So we know that the burden of these bloodstream infections in the US underscores the importance of robust infection prevention strategies. And as we said, there has been progress made. Continued efforts are needed to enhance patient safety, minimize the infections, and address these economic and clinical challenges posed by the bloodstream infections. Next slide, please. So before we start, I'd like to clear up some definitions that are very important, because these definitions allow the CDC and other organizations to clearly define ways to make them better. And you'll see in some of the toolkits that we have later in the slide, and some of the checklists, that these definitions also help the centers and everybody involved with this report the statistics of bloodstream infection. So this is why I have to say this out loud with you. So we have a primary bloodstream infection, which is a laboratory confirmed bloodstream infection, not secondary to an infection at another body site. Okay, and we have a secondary bloodstream infection, which is infection seeded from a site-specific infection at another body site. Let's say you have a pneumonia, UTI, or a soft skin infection. So then we have this other laboratory confirmed bloodstream infection is when, unfortunately, you get it through some other laboratory testing, not as the primary bloodstream infection. We have this other one called secondary bloodstream infection, which secondary blood BSI attribution period, which has to deal with the time of infection, which is 14 to 17 days. Okay, and these bloodstream infections are among the most significant complications faced by dialysis patients, particularly those using the central venous catheters, as we said before. Almost 75,000 patients are using catheters at the moment. So the immune compromised status of all these patients who are on dialysis, coupled with repeated vascular access, creates a very high risk environment for infections. And we know, actually, next slide, please. There's some other terms here that I'd like to just clear up. So the additional terms, so we have bloodstream infection, BSI, and central line associated bloodstream infection. They're kind of interchangeable, or they are interchangeable. And some other key definitions I have to say is the infusion part, because we know that we can get infusions, whether it's for continuous infusion, whether it's nutrition or medication, if it's for antibiotics. So all these terms have to deal with bloodstream infections. And although we are talking about dialysis only today, there are other ways to get bloodstream infections. And as you see on the right side, we talk about access, and this could be either from a central line placement, whether it's from the infusion or blood withdrawal, whether they're trying to monitor the heart for hemodynamic stability. So these are very important key terms that one must know. Next slide, please. Before I go through this, I like to say that the bloodstream and the BSIs, lead to increased morbidity, mortality, prolonged hospitalizations. There are many bad things that happen. And some of those include endocarditis, sepsis, osteomyelitis. So there are long-term impacts, long-term increased financial burden. So we need to decrease BSIs. Okay, so this slide has to deal with access types, and I put it in order on which is lowest to highest infection risk. And AV fistula, there was a famous slogan, fistula first, which is controversial. I know NANT will be giving some of lectures in the coming year, and we have Dr. Daniel Patel, who is an AV fistula expert, and he will say that, of course, fistula is the way to go. It doesn't work like that in real world scenarios. A lot of people have different ways of describing if they work or not. So the nursing staff, will know too, because there are new technology that are coming out for creation of AV fistulas, hoping to learn that in the coming year. But AV fistula is the least likely to get infection. Under that, we have an AV graft, and then the most serious complications come from tunneled central lines and the non-tunneled central lines. The difference being non-tunneled is out on the skin, where tunnel line is you have to have a professional place it underneath the skin, which I have seen patients who have had tunnel central lines for a very long time, years, whereas the non-tunnel central lines do not last that long. So yes, next slide, please. So in this presentation, I'm going to be promoting the CDC recommended infection prevention practices in hemodialysis. One second. And these audit tools and checklists can be used by individuals when assessing staff practices. The audit tools and checklists below or in the following slides are intended to promote these practices and help decrease BSIs. Next slide, please. Okay, so our first one, proper hand washing. Sounds pretty basic, but this proven technique has is essential to prevent harmful germs and healthcare associated infections. It works so well that we've created this 5 moments of hand hygiene that is easy, but let me tell you, we don't do it. I don't know why, but we don't wash our hands. It's kind of gross when you think about it, but we don't do it well enough. And if we do, this is one of the easiest ways to prevent infection and the most effective one too. So as you see here, the World Health Organization has these 5 moments of hand hygiene, which include before touching the patient, uh, before cleaning the aseptic procedure, after body fluid exposure risk, after touching the patient, after touching patient surroundings. So they have it very easy. I'm sure you've seen this up in the dialysis unit or in your hospital. Um, so yes, hand hygiene, the most important one. Next slide, please. Okay, so the key moments for hand hygiene, and I have a story to say after this. Upon entering or leaving the treatment floor, in our hospital at IU, we have a foam in, foam out, big posted picture on every floor. And I've learned that, if you don't wash your hands or foam, even when you're not involved with the care of the patient, I'm in training, so we're always following like little ducklings, the attending to go into different rooms. And, I was on the back part of the group and I was maybe one step inside of the door and there was a the charge nurse on the floor who called me out, said, Dr. Khan, you did not foam out. And I didn't even touch the patient. And she goes, do you know how many times we get infections from not washing your hands? And it opened my eyes because it's such an easy thing to forget and not do that it can get the best of us. So I have learned when I'm around the charge nurse, that one specifically, always wash my hands. But even when I'm not around anybody, it's always important to wash your hands. So after glove removal, after making any contact with any medication, you need to wash your hands constantly between tasks at different patient stations, going in between rooms. Um, and especially when you're changing the vascular access and the dressing changes, you have to have your gloves on. You have to have new gloves on. So any sort of touching of any surface at a patient station, these are key moments for hand hygiene. Next slide, please. So this is our first toolkit. So here you can see CDC is trying to make dialysis safer. And this has been documented in the previous decade that this collaboration was going on. It was called the Making Dialysis Safer Coalition, that this decreases infections, and it's because of toolkits like these. And as you can see, they have this guide on how to and when to provide instructions on when to wash your hands. It sounds so basic, I know, but it's something where it's proven to work. You have to say it out loud like this. So the evidence-based impact on proper hand washing is the cornerstone of infection prevention, recognized globally as one of the most effective methods to reduce the transmission of harmful pathogens. So dialysis units, ICUs, these all serve as critical barrier against healthcare associated infections and bloodstream infections. So hand washing is also important to talk about the technique. You can't just put some water on your hand and, call it a day. So you have to effectively and properly hand wash. Secondly, remember that we have to use alcohol-based, there's, yeah. Okay, next slide, please. So this is your toolkit. This is, yeah. So next, proper personal protective equipment. We just went through COVID not too long ago. I entered my internal medicine training during COVID. Would say it was traumatic and also scary, which you guys are all aware of, how we were all affected. But one thing that was important was before we started any of this was trying to figure out PPE. And this was taught to me by my pulmonary and critical care fellows at the time. And we had a few days of doing this, the proper way, in the proper, what's the word? The proper order, excuse me. And, this should always be worn by staff to avoid the exposure. to infectious blood and body fluids when connecting and disconnecting catheters. I'm sure most of you have seen in dialysis units that everyone is wearing these. It is important. And secondly, masking. Masking is so important during the catheter access care and when holding gloves and when you're holding pressure to access sites. So please don't forget how easy it is to forget. It's also one of the most effective ways. Next slide, please. So there is something else which I'd like to discuss, which is the isolation rooms. And in COVID, we had COVID rooms, especially, but we all must also not forget about hepatitis B patients in a separate room, separate equipment, instruments, supplies, all of it. It should be made sure that they are in isolating rooms, wear a separate gown when treating these patients. And here at the bottom, we talk about not having staff members caring for patients with Hep B who are Hep B positive, or should not care for HBV susceptible patients at the same time during the same shift or during patient changeover. So these are, identified risks that we must follow. Next slide, please. I'm just going to catch up on my note section one second. So another easy one to say out loud is cleaning and disinfecting the dialysis station. So your standard Clorox wipes don't work. Inpatient, we have even stronger ones that require gloves to put on to clean the area. We must clean all the equipment. Every station that you touch while treating dialysis patients is important. This is going to reduce the risk of spreading the infection. So the alcohol wipes are very effective, but it can also be done using cleaning detergent. Water and friction is intended to remove the blood and body fluids and other contaminants from objects and surfaces. This disinfection is a process that we know that kills many or all remaining infection germs on the clean objects and surfaces. This EPA hospital grade disinfectant will smell very, will remain on your hands for a long time, but it is effective and it works. And just make sure that you are wearing gloves during this whole process. Next slide, please. To continue with that even when you're done cleaning the patient and another patient is not there, you must continue to disinfect the dialysis station, chair, machine, tray, all of it, every time, all surfaces. And they should be wet while the disinfectant and allowed to air dry. So I'm talking every area with the wipe should be touched, the surface areas, and it's important. We're trying to reduce infections. So next slide, please. Here we go, another CDC toolkit. So we're not playing around here at the CDC, and we got another checklist here that talks about routine disinfection at the dialysis station, what to do after the dialysis station. I believe this is the same the same logo, the same image, but what it's trying to say is that you must follow all these steps. It's very easy to forget, but it's so easy to print this out and have this at the station. At IU, we have these all over the room, all over the station. So it is easy to forget too, but that's why we have an awesome toolkit like this. Next slide, please. Okay, so the type of access sites and risk of infection. So as we mentioned earlier, we have the most dangerous one and high risk are the central line catheters. Either can be tunneled or non-tunneled. Tunneled being a little safer as it's underneath the skin, whereas the non-tunneled is outside. Although there is some technology being currently through the works where there are antibiotic instilled in these catheters to make sure that they don't get infected. There is a doctor here in Indiana, Dr. Stephen Ash, who has created a prototype of a skin level catheter, which would kind of fold out like an accordion. It's incredible, and he's been working on it and actually presented it at ASDIN last year. So technology is changing, and we are innovative in this space, and it is something that still needs to be worked on. So as you see here, AV graft and AV fistula make up the rest of this risks of infection. Next slide, please. So I have to talk about the hub protocol. And this refers to the, first, scrub the hub protocol is the next few slides, but just some definitions to throw out here. A catheter refers to the central venous catheter or central line. The hub refers to the end of the CVC that connects the blood lines or cap. The cap refers to a device that screws on to and occludes the hub. A limb refers to the catheter portion that extends from the patient's body to the hub, and the blood lines refer to the arterial and venous ends of the extracorporeal circuit that connects the patient's catheter to the dialyzer. Next slide, please. Yes, so I wanted to just mention that, okay, just catching up to my, so the Scrub the Hub protocol is a critical infection prevention measure designed to reduce these catheter-related infections and healthcare settings. And its success underscores the importance of standardized practices in infection control and the need for regular staff training and compliance monitoring. So all these checklists, all these toolkits, mentions feedback. It talks about, supervise, everybody just helping out to make sure you're doing it the right way. Okay, next slide, please. So key takeaways. We are talking about this aseptic technique, which by definition prevents contamination of clean or sterile items and surfaces. And the CDC talks about these best practices for aseptic techniques, which is avoid using contaminating gloves. It sounds ridiculous sometimes, but you can forget in the moment to change gloves if you're hopping in between patients. I mean, medicine is hard. There's so many things going on. Nursing staff, I tip my hat off to you because you are dealing with one or two patients that have a bunch of alarm. There's like 200 alarms going off, a lot of things going on. And this is why it's very important to make sure that you are doing the things that are so basic all the time. And this comes with practice. So, maintaining the focus on these aseptic tasks begin to ensure proper execution. Next slide, please. So we talk about some other key aseptic techniques. And if you're not using alcohol, you could use povidone or iodine with alcohol, or at least 70% alcohol for patients who have the chlorhexidine intolerance. And then we have CDC guidelines, scrub the hub. There's a link later if you guys get the presentation or the references at the end that will have a link to this. Next slide, please. So which hub should be scrubbed? Okay, scrub the hub. Every port of the system, every line, every side. The injection ports into the bags or bottles, injection ports on the administration sets. All these things come in plastic, but when you open them, you should still clean them. So any needleless connectors, the hub of the catheter, always cap stopcocks and injection ports when not in use. Very important. Next slide, please. Okay, here we have another checklist. So this is great. They talk about the connection, disconnection, exit site care. These are all things that are going to should be printed in size 25 font, put next to every station. It's only there to help you. Yes, it's like Big Brother watching over you, but these are proven techniques that are effective and save lives. So yes, next slide, please. And we have another toolkit. So here we have, as you can see, these audit tools, and it almost seems like you keep doing these audits, but it's the only way to help, and it's proven to help. So don't be scared because it seems like they're trying to almost get you in trouble because you're not doing that, but this is all to save lives. And if we're not at our best practicing every patient every day, reviewing these, it's the only way that we make sure we save lives. So don't be afraid of this. It's only there to help you. Next slide, please. Did someone say another checklist? Well, we have another one because with injectable medications, we also have to perform the same hand hygiene, the new gloves. And it sounds repetitive, but these things are important. So, very detailed, attach the syringe, administer medication, aseptically. And here you can read along with me, just another checklist to make sure that we are doing the correct thing. Next slide, please. So these audit tools for the meds, a catheter disconnection, they're just it's an essential instrument to ensure our adherence in this setting for aseptic techniques, because we know that by promoting patient safety through systematic monitoring and feedback will save lives. Okay, next, so yeah, next slide. Okay, here we go. For AV fistulas and grafts, we have another checklist. And these are all available for free, of course, through the CDC. Very easy to download these. I can point you to where to get them. I have a link at the end of this presentation for these. And again, just in plain language, what you have to do. This is great. This is what I want to see around at every station. We see it at IU. I work at a few different hospitals. The VA has it. The VA has a lot of these, but even at IU and Eskenazi Hospital, which is one of our other hospitals here at IU, these are all over the dialysis room. Yeah. So next slide, please. So another audit tool, making sure that we're following along. We have all of these, laid out pretty easily for you. And yes, next slide, please. Okay, so here is something important, and it's some tips to prevent infection. And obviously, keep your dialysis access site clean, avoid scratching or picking it. This is geared towards patients, so this is something that we can share, and we constantly repeat this over and over with them, but dialysis patients are smart. Nobody wants a bloodstream infection. Nobody wants to get antibiotics for 2 weeks or longer. All of this is not fun for the patient, so it is in our benefit to repeat these and talk about it and make sure we tell them, hey, are you making sure it's clean? And also looking at it ourselves. Sometimes we don't change bandages, sometimes we make mistakes. So it's always good to follow up on our colleagues and the patients to make sure that we have the cleanliest area for the to prevent infections for the grafts. So also important, and this is in, excuse me, is recognizing signs of infection and explaining to the patient, hey, this could hurt, or if this happens, watch out for this. So, we have this problem in medicine where we say a bunch of fancy words for no reason and try to confuse patients. An example is research in medicine. We have a lot of fancy words and papers where a lot of it should be more plain language for patients, for people to understand, so we can recognize things that are when they're not going well and how to improve them or make them better. So understanding all of these issues and talking to your patient about this is very important. Next slide. So catheters being the most high risk, I'd like to go through each one of these. As we know, it's the highest infection risk. And here's ask your doctor about transitioning to a fistula or graft. Yes, it's ideal, but some patients don't want a graft or a fistula. They don't want it. And it's very common. And, a lot of this is the unknown for patients. So dialysis not easy. Dialysis does not cure the patient. Dialysis is hard, and explaining to patients all their options and letting them know what could happen if you continue to use catheters is important too, because the last thing you want is to have an admission because you have to get IV antibiotics. Not fun. So learning the proper catheter care at home, what happens when it gets wet, when to contact your dialysis center for help, when to seek help, again, frequent hand washing before, after dialysis, what are the required steps healthcare providers should follow when using the catheter, identifying signs of infection and have a plan of action if infection develops, and understand how to handle any problems with your catheter. So these are all things that are in size 50 font that should be in your dialysis center, anywhere where your nephrology office. These are going to be posted on the wall everywhere. Super important. Next slide, please. Okay, so what are some control practices for the units? We have 5 here. Implement precautions to prevent the transmission of bloodborne viruses and the pathogenic bacteria. Every patient should have initial serologic testing for Hep B and Hep C. Uh, uh, Knowing, I always get a high five if I order this test, knowing a patient will be going on dialysis. Your charge nurse in the unit is going to be ordering it anyway. So these are things that need to be done. You got to vaccinate against Hep B if possible. Um, uh, Isolating patients who are on who have Hep B, surface antigen positivity, and then vaccination. Super important, very important. Ensure the patients are up to date. Flu, pneumonia, COVID, hepatitis B, all of it. You have to. This is our role as a physician, to explain to the patient that vaccinations are very important. They are key in order to prevent infections.
Would you
Next
add
slide, please.
RSV vaccination to that list?
Yes, depending on the age. Yes, of course. Thank you for adding that. Now, um, there is also another checklist of all the vaccinations that we should get. So I just briefly put in here, but you are correct. Um, Now, in the units itself, surveillance to go along with all these audit tools and checklists, so important. If we're not on our colleagues, making sure we're giving the best care, the cleanest care, aseptic techniques every time. That's how we monitor these infections, and we can help reverse the adverse events. The training, education, so important. CDC is beautiful with all their toolkits and their very one pagers that they put on the walls. I, for one, enjoy them. We have a bunch printed out in our nephrology clinics in the VA and also at IU that we hand out. These are so easy to give to a patient, and it's like it's their images. They're not even, fancy words. It's just things that you need to do: mask, hand washing. So these training, even the training for healthcare providers, is the most important. We are guilty of a lot of these very basic things that we learn and when we start out in this business, but we have to make sure we do it every day, all the time, every time. So yes, now to talk about the CDC core interventions for dialysis BSI prevention, kind of reviews everything we went through in the previous slides. Surveillance and feedback. So this is NHSN is the body from the CDC that receives all the statistics, and they actually have a lot of amazing information in the references. So you'll see this at the end. So through the NHSN, we do all the surveillance feedback, compare rates to other facilities. We share results with frontline staff. Super important because reporting events, monitoring events, feedback, all of this is how we are saving lives. Next slide, please. Yes, so hand hygiene. Okay, let me just get to hand hygiene. We need to conduct monthly audits of hand hygiene opportunities, provide feedback to clinical staff. Again, I'll never forget how I got called out. I was at the back of the group, the ducklings, and following the rounds. I was all the way in the back. I had just presented a patient in the other room, and I put one foot in the room, and I foamed in, and I immediately came out. I was nowhere near the patient. And she, in front of my attending, of course, said, "Dr. Khan, I noticed you didn't foam out." And I blushed. It was embarrassing, and I haven't forgotten. So if people call you out or are telling you, "Hey, just make sure," don't be offended. It's only to save lives, right? And at the end of the day, that's why we are in this business, is to make sure people don't die. Next slide, please. Okay, so some observations. Make sure that the catheter vascular access care quarterly is, always clean. Dressing changes. We make sure that they know about the aseptic techniques. to ask the patient, hey, do you know what you're doing? Can you show me? That's I find the easiest is, hey, show me how you clean it at home. And that way you put it in the patient's hand and you can figure out how they're doing it. And also just observing your colleagues, because they are as good as you, and that's how you learn. So next slide, please. Now, staff education competency, again, being graded on this and in evaluating people's skills, and it's repetitive, but it's so important to do this. And we have to train on the aseptic techniques, catheter care. You're doing this quarterly, every 6 months. It says here, like, this is not something you learn once. You're constantly getting better at doing it until it becomes automatic. Next slide, please. Uh, so providing standardized education techniques, standardized education on vascular access care, the hand hygiene, what to recognize if something's going wrong, highlight the risks of catheter use, proper access management. So remember, engaging with your patients and talking to them, the most important. They need to know what's going on. Next slide, please. So catheter reduction. Now, so there is the fistula first slogan by the CDC. We want to promote permanent access through a fistula graft. This is exciting because in the interventional nephrology world, we have endovascular AVF techniques. I mentioned Dr. Daniel Patel out of Florida. He is an expert at this, and he is very good at this and has excellent success with it. And all over the country, endovascular AVFs are working. It may be controversial to some old school doctors, some current doctors too, but it is a way to promote decreased catheter reduction. At ASN this year in San Diego in 2024, not too long ago, there was a new technology being and a lot of stuff. This is definitely it's an innovative field, and things are changing for the better. So I'm looking forward to it. So identify these barriers to removing the catheters, and then also talking about patient education regarding vascular access coordination. You don't want the patient, a word that we learned is crash land into dialysis, which I'm sure you guys have heard. So always talk about coordinating. It's always better to do things as a prevention instead of doing it at the end. Next slide, please.
Dr. Dan will be a speaker at one of our subsequent webinars.
Oh, yeah, I'm excited for it. He's great. I've listened to him speak a few times, and in person, he's great. I'm looking forward to that. We're in for a treat. So remember, chlorhexidine for skin antisepsis, and very important. Did we skip one slide maybe? No, we did not. Okay, we're good. Yes, sorry. So chlorhexidine wipes, if you're intolerant to them, you can use the blue povidone iodine with alcohol or 70% alcohol. So skin antisepsis septic techniques, very important. Next slide. Remember, scrub the hub with the antiseptic after cap removal or before access. Perform every time that catheter is accessed or disconnected. Next slide, please. The antibiotic ointment is very important, especially for our peritoneal dialysis patients, using the gentamicin cream. I'm always looking at the catheter infection site or catheter site in the belly, wherever it is. You always have to look at it. And, the nursing staff has they are very good at it, but even as physicians, when they're inpatient or in the clinic, we have to look for this. So another important, next one, isolation precautions. We talk about the CDC guidelines for Hep B, dialyzing in a separate room, separate equipment, supplies, the staff caring for HB surface antigen positive patients should not care for these susceptible patients at the same time. Remember, surveillance and routine serological testing for Hep B, Hep C is important, and vaccinations. Next slide, please. So this is the environmental cleaning and disinfections. Remember, clean every surface possible. It has to be a high EPA registered hospital grade disinfectant. Treat all surfaces after contamination, and as the CDC toolkit will easily say, you just follow that. It's too easy not to follow. Next slide, please. As we talked about the different types of infection, CVC being the highest risk, AV fistula being the least risk. Next slide, please. So the scrub the hub technique, remember every connection port is a potential portal of entry for infection. So we want to make sure that we are using aseptic techniques every time. The CDC protocol talks about using a closed catheter system, using the chlorhexidine. Yes, so we discussed this. All right, next slide, please.
Oops, sorry.
Okay, and then we talked about the safe injection and medication preparation. You have to use single-use vials. Make sure the injectables are cleaned in a designated zone, a clean zone. So a lot of rules to follow, but this is what's been proven to save lives. Next slide, please. So this talks about again, the patient empowerment. We're teaching the hand hygiene, the red flag signs of infection. You're watching the patient do this. So it's important to get the patient to talk to you about what's going on. This patient empowerment. So CDC has a Speak Up video series, which is excellent. It talks about infection prevention resources, something you guys can take a look at. Staff training, using the CDC checklist, audits for consistent practice, and we are lifelong learners. You aren't going to learn this once and just know it forever. You have to get it wrong sometimes, but also make sure you identify when you do get it wrong and improve and do better. So yes, so some components of these infection control program essentials are the standard precautions, which is the PPE, sharp safety, hand hygiene, surveillance, monthly audits, track infections, vaccinations, isolation protocols, and utilizing the CDC toolkits, checklists for the station cleaning, hand hygiene, AV access care, and injection safety. Next slide. So again, we want to reduce catheter use when possible. Remember to adhere to the CDC guidelines and educate and empower and equip patients with all of the tools that we have on our side of the dialysis world to the patients. So here are some references I have. The Speak Up video series is kind of cool, and it would be cool. It would be nice if you guys check that out. And then we have some other checklists here, which are available on CDC. Very easy to get to. And yes, and I believe we have the last slide, which is talking about the CDC dialysis infection prevention toolkit is great because it gives a structured team-based approach, and it has these scenarios that you can go through to learn and figure out what you're doing. So there's like multiple choice questions, and this is how, as a team, because being on dialysis isn't just the patient, it's the nursing staff, the physician, the techs, name it. There's like 10 people involved, and they're all important. So remember, it's a team-based approach. So thank you all very much for listening. On the next slide, we have some more links for the Scrub the Hub and the CDC infections. I think there's one more slide, yeah. And yeah, so thank you very much. Any questions or anybody want to ask anything? I'm open to the floor.
I am trying to put the rest of these links in the